Let's see. Oh, okay, we're live. You just told me we're having internet issues. Hi, everyone. Good evening, good afternoon, good morning. This is a voice on the face of Dr. Tolu Olabinton. I'm the CEO and co-founder of the Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you are watching live, please hashtag live. If you're watching replay, do hashtag replay as well. I do have a favor to ask. If you have friends who could use this conversation today, we're talking about probiotics and gut flora and how we can help our stomachs feel a little bit better. You can tag them in the post. You can comment. You can share this message with them, and we'll go right on. Okay. So thank you all for joining me live. And some of you may be wondering why we're talking about this. Well, these topics are picked up actually based on conversation with my clients, patients like you. Some of you have sent in requests. Please keep them coming, like topics you want me to talk about, things that pertain to you, or things that you would like to have more insight on. We can have that conversation. You can simply message me and say, "Hey, doc, I'd love for you to come talk about this." Okay. All right. So that is why we're talking about the things we're talking about today, because this is a very, very important topic, and it is very important because your gut health actually affects your overall health, right? Your gut, your stomach, your colon, your intestines, your GI tract, all of that is important in absorption of nutrients and also expelling things that are not quite nutritious for you or byproducts of foods that we've digested. So let me make sure our guest is coming. I don't see her in the backdrop. Let me make sure. So give me 1 second. While we're waiting, go ahead and invite your friends. Tell them, come on. We're about to start. Um, let's see. Let's see. All right. So she should be joining us soon. All right. All right. Okay. All right. So for those of you who are watching, if you're watching from a different state outside of Texas, you can comment what state you're watching from. I'm so happy it's a Tuesday. Sometimes it's hard for me to tell who's on, so I see that we have some guests. You can put your name there so I can give you a shout out as we prepare for this topic. All right. And so we're talking about probiotics and gut flora stuff. So while we wait for our guests, I'm going to start talking about what all of this means. Okay. So some of us have heard about probiotics. What are probiotics? They're essentially live, I know it's going to sound a little weird, live bacteria, live yeast that are actually important for our digestive system. Now, I want you to know that actually bacteria, um, yeast, they're actually our friends. A good number of them are. All right. And so one of the things they help us do is help maintain a normal pH around certain parts of our body. They also aid in digestion. So you want to have good gut flora. You want to have the good kind of bacteria that would actually help you digest your food and actually cause more good than harm. So those are what probiotics are. So in our gut, believe it or not, there are over a billion, a trillion different types of organisms or microorganisms that actually hang out in our gut. All right. And what these things do is, or what these little tiny microbes do, is they actually help us break down our food. Okay. So it's important that we maintain a healthy relationship with them. We don't want to get rid of them. We don't want them to diminish significantly because they actually help. Because when they're away from our gut, then other non-helpful bacteria or non-helpful yeast can overgrow and cause issues. All right, our guest is here, Dr. Vivian Asamoah. I'm going to bring you on. How you doing? You looking good?
Everyone. Hi, Dr. Tolu. How are you?
I am doing well. I'm doing well. Nice to see you. And I was just talking about gut flora real quick before you showed up. So yay, I'm glad you're here. I'm going to give you a brief introduction. Dr. Vivian Asamoah. She's amazing. She's a GI doc. She's a speaker internationally. She's an educator. She's a patient advocate. And she is a board certified gastroenterologist. And she's big on evidence based integrative and functional medicine. I'm going to let her explain what that means. But, Doc, it's really, really, it's a pleasure of mine. I'm a big fan of yours to have you on today. So, thank you for coming.
Thank you for having me on, and I am so grateful to be here with your audience. This is fantastic. I've been looking forward to it. I feel like a rock star, like, on Dr. Tolu's show.
You are,
I
you are, you
couldn't
are.
find the Zoom login or whatever, StreamYard. But I finally thank you for sending it to me.
No
Thank you
problem.
so much. Yeah.
No problem. My pleasure. Now, for those who are wondering, can you introduce yourself again? What do you do? And who are you?
Yeah, so well, I'm a mother of two. I'm a wife and a sister to four brothers. But besides that, I'm a gastroenterologist. So we are the docs who deal with a lot, everything that starts from mouth to anus, and then also includes the liver, the pancreas, the gallbladder, so other organs surrounding the abdomen. And so we do internal medicine first after medical school, and then we do a subspecialty training in gastroenterology for 3 to 4 years. So we are the people who do those colonoscopies that nobody likes getting, but everyone should get to prevent colon cancer. So we do the screening colonoscopies. So, I've kind of entered into this field of integrative functional medicine. And that segued because as a gastroenterologist, I really quickly realized that prescription medications could not fix my patients. I felt like I always had to go back to, so what are you eating? What must be food? Like they say we are what we eat, right? We are what we eat. And so that had to become a huge component of my practice to do well for my patients, to provide the best care possible. So without incorporating nutrition and lifestyle, I noticed I was not able to get the results. I really was not able to help as much as my training, my awesome training was. And once I started learning more about how to help my patients about, with in terms of nutrition, lifestyle, stress, and how this can affect the gut, we saw much better results. So I did additional training in
Mm.
integrative and functional medicine after my board certification as a gastroenterologist, and also certified as an integrative functional medicine expert. And my focus is really the gut. And a lot of integrative specialists will say that it all begins in the gut,
Right.
and so it's a big part of our well-being. And the microbiome that we're discussing today is also a huge part.
Awesome. Now, before we go into the nitty gritty of the themes, why do you do what you do?
Why do I do what I do as a doc?
Yeah, like how did you get like I'm always curious to ask my guests like what got you started in this line of work?
What got me started as a physician?
So GI doc particularly. You like to
Oh,
let's yeah.
my story is awfully boring. Unlike many of your guests who have wonderful stories, mine is just very boring. Are you sure you want to hear it?
Yes.
Okay. My daddy said go to medical school.
That is fair.
My daddy said go to medical school. So I was like, okay. And I did it. I loved it, right? And then in medical school, I ended up doing internal medicine, and I was like, I wasn't sure what to do. I really thought I was going to do public health policy work, go on the field in Peru, Guatemala, saving lives. And I ended up doing a couple years in basic science research in gastroenterology and really loved the science. That's why I was
Mm.
looking for evidence. So my mentor, Dr. Shanti Shitaraman, she's passed away now, said, "V, you're gonna do GI," and I was like, "No, I don't know." And when I got to Hopkins for residency, my mentor just said, another mentor there said, I guess almost like my doc daddy or my daddy doc, my doctor, daddy, my second dad.
I got you.
Right, yeah, and he said, you just gonna do GI. That's great. You just gonna do that. And so they offered me the spot, and I just did GI. That's it, and
Wow, I love it.
I loved it. That's it. So I think God works in very mysterious ways, but I think for me in my life, He's always kind of put me at the right place. Sometimes that place is a difficult place,
Mhm.
but difficult for me. But in His eyes, I feel it's always the right place. So God's time is best. So that was it. Or
I love it. Simple, and you fell, it fell right on your lap. You ran with it. So
yeah,
that works. All right. So let's talk gut flora. I was talking about it earlier, but what's the big deal about gut flora? Like, what is it, and why should one maintain a good balance of it, Doc?
yeah. So I guess we're realizing over the last 1 or 2 decades how important this gut flora is. They say we have trillions of bacteria in our gut, and if you actually look at things cellularly in the human being, we live synergistically in this ecosystem. Our human body is an ecosystem with bacteria, right? Good bacteria, viruses, sometimes even parasites. We live in harmony with these organisms, and these organisms are not always bad. Actually, a lot of them are good for us and actually help us digest food, make neurotransmitters, metabolize vitamins, and do many things in the body. And so we're realizing that, and there's actually more organism cells that are non human in the body than human. So we are really composed of bugs, truly. And a lot of these bugs reside in our gut. And they have important functions in terms of our immune system, in terms of our nervous endosystem, so our nervous system, so neurotransmitters, in terms of hormones and how we produce and how we metabolize and detoxify. Very, very important in our gut. So that's why I think the microbiome and the gut flora is so important, because we realize how important they are in the everyday human cellular processes, right? Very much more important than we realize. So that is the importance of, you want to have and maintain a healthy balance of good bugs. And we talk about bacteria a lot because they're predominant, but it could be virus, it could be parasite, but a healthy, and it could be even yeast, right? But you want a healthy balance of all, right? To maintain a good ecosystem.
So let's talk about the how. How do we make sure, or maybe before I get to that, how do we know when our gut is not good? Like our gut flora is not good. Are there telltale signs that give hints so we
You
know
know,
that, oh, this could be the issue?
absolutely. And the telltale signs are a lot, because, these gut bacteria don't only give us symptoms in the gut, they also give us symptoms beyond the gut systemically. But if we should start in the gut, you may start noticing a change in your BMs, bowel movements, meaning how often you poop. You may notice you're not going as often. You may notice diarrhea, bloating, even sometimes heartburn, indigestion, right? That means the microbiome is a little off. But even pushing beyond that, when that happens for a long time, you may even start noticing fatigue,
Mm-hmm.
poor, it starts affecting now other things. Your immune system is weaker, right? You're prone to infections, right? But usually it starts in the gut with GI symptoms that then we notice. You're maybe not tolerating certain foods a certain way as you used to. So we know the microbiome is off. Very often this is triggered by bad a poor diet, let's say poor choices. We never say bad food. No food is bad or good, right? Poor choices. And sometimes it's what we do to our patients, right? Prescription antibiotics for every little cold that you can really just handle and let the body handle naturally. We get antibiotic, 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 or take medications like Motrin and Advil too often. That irritates the gut and can cause issues there and can affect our microbiome. Or as sometimes we're recovering from a bad infection like COVID, caused a
Mm-hmm.
lot of gut symptoms too that alter things long term. So many reasons, but the main symptoms usually start in the gut.
Okay, very good. And thank you for delving into also the things that can also contribute to that. Now let's talk probiotics. There's a big pro and prebiotics, and oh, take this and that should fix this issue. Doctor, can you speak on probiotics? What are they and how do they affect health?
I would love to. So probiotics, hot topic, right? Hot topic. And let me just start by saying one takeaway pearl that I would love for all your audience, and those patients of Living Spring Family Medical Center to take away from. If you don't remember anything, maybe you just remember my short red hair. But if you don't remember anything, don't waste your money on probiotics if you don't eat well. You can't pop a probiotic and be eating fries and burgers. There is no point. You are wasting your money. Okay. You can't pop probiotics and just be eating like French fries and, oh, let's go eat this and be drinking a whole bunch of alcohol. The probiotic is squashed. Don't bother. Okay. It all starts with a healthy diet and healthy choices, right? When they look at our people who live in the blue zone, so they've looked at these people who live the longest, who have the best microbiome, really don't have a lot of medical issues, right? They don't take probiotics. These people live in the depths of Japan and Peru and different parts of Africa. They don't have access to probiotics. They get it naturally through a wholesome, clean diet, no processed foods. So that's your best probiotic, honestly. It's what you put in. But probiotics, from a gastroenterology standpoint, if you look at the guidelines from the American Gastroenterology Association, they only really recommend probiotics maybe post infection. Like if you got a gut infection, right? You went to Cancun, you partied, you ate everything, right? You came back with traveler's diarrhea and you were really bad and you're recovering from that. It is helpful to take probiotics to kind of reset your gut for about
Mm,
30 days, right? That's helpful. 90 days if you want to prolong it. Or if your doctor gave you antibiotics, right? Because maybe you had diverticulitis or some kind of inflammation, and now you kind of want to reset. It's helpful then to take probiotics. There is no evidence that probiotics on a day to day chronically for everybody
mm,
makes a difference. That's
mm,
the evidence, right? That's truly the evidence. Now, as an integrative medicine and functional medicine expert, have I seen probiotics help some of our patients with IBS, some of our patients with chronic constipation? Yes, I have. Although the
mm,
data does not necessarily support it, data isn't everything. A patient's experience is, a patient's their own body is very personalized, what happens in their microbiome. So in some people, I tell them, yes, go ahead and try. Make sure you're having a clean, healthy diet. And we give it about 90 days. If we see no difference, we stop.
mm, mm. Mm. I love your approach, the minimalist approach too, and I love how you squash myths without even asking, as to like,
Okay.
yeah, I can eat whatever and just take probiotics and my stomach will just fix itself. But
It
there's an
doesn't.
important part of the, our choices when it comes to eating foods, and you mentioned limiting or avoiding processed foods and heavy actual alcohol intake. So, big pointers. I appreciate you for that. And you talk probiotics, the timing, not every day necessarily, but worth the maybe 3 month trial. I love that. But how do we choose the right probiotic? Let's say I have a viewer who's watching who says, yes, I eat well. I have to be on antibiotics because of some of the medical issues I have. And so, how do I choose the right probiotic supplement for my
Yeah,
needs?
I think that's a great question, and I think with this one, it is always good to ask your primary care doctor, right? Your physician, because there is so much on the market. Probiotics are not FDA cleared, so it's
Mm,
a supplement. And many people can brand it for different things. I mean, people are saying, oh, this probiotics helps with weight loss. This probiotics will give you green hair. This probiotics is going to make you slim. This probiotic will make you cute. So people are just branding whatever they want, and the FDA doesn't necessarily regulate this.
Mm,
So it's
mm,
important that if you're selecting a probiotic, show it to your doctor, show it to Dr. Tolu, ask her what she thinks of the brand. You want to make sure that this is a brand that, we have some nice supplement brands where they can show they've done research. There's some evidence, right? Where they are cleared by a third party quality search company, right? Yeah, so you can see that it'll say, oh, we have a third party quality search that we've done clearance with, and we've tested our brands. But beyond that, you're looking for a probiotic that has multiple strains, right? As we said, there's trillions of bacteria coming from different genre, family, species, but you're looking for a probiotic that has multiple strains, so that brings diversity. Diversity is really important, right? And generally, I would say has at least a good 15 billion, right? Because we have trillions in our gut. So to make a difference, if not, it's just like putting a drop of water in an ocean. So you want to put a larger drop if you can for a longer period of time. So I use 50 billion strains is what I use. I use brands that are well known from companies that are reputable, where there's some research done. And you have some probiotics which have to be maintained in the fridge, and some probiotics that you can just take over the counter and over the on the shelf. Both are okay, but with the ones that have to be maintained in the fridge, you have to keep them in the fridge, right? If you leave them at room temperature, they may not be as effective. So guidance is important. There are some basic ones over the counter, and I'm not sure if I'm able to share name brands.
you
um,
can, yes, you
yeah,
can. And
there
I didn't
are
know
some
that these are medical
basic
supplements.
yeah, there are some basic ones that I always recommend. So I like companies like Garden of Life has a
Okay.
good probiotic supplement line. Garden of Life is very good. Orthomolecular has good supplement lines, designs for health. And generally, if people just want to start with a basic, I say try Culturelle or Align.
Okay.
Those are good brands, right? Flora Store is a yeast-based probiotic that is also very good after an infection, like something like C. diff, because it's a Saccharomyces boulardii yeast-based probiotic, which is super helpful. So Flora Store, Culturelle, Align are things over the counter you can just grab at the store. If you want something that is a little bit, sort of a higher quality grade, then you're looking at supplement lines like Orthomolecular, Designs from Health, Microbiome Labs, Zymogen. And for that, you may want to consult, a provider, a physician who's well versed in that. But good place to start with those over the counter ones.
Awesome. Thank you. I like Florasta. I like a line too.
Yeah.
Awesome. 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 Now, you talked about it a little bit earlier, but I wanted us to re-emphasize, are there any dietary or lifestyle changes that can actually enhance the effectiveness of probiotics?
Oh, absolutely. So that's where we talk about prebiotics, right? Prebiotics are the foods that pro, bacteria in your gut love to eat to grow, especially the good kind of gut bacteria, right? So prebiotic, you want to eat prebiotic rich foods to make sure that you're developing a healthy microbiome. And these include, I mean, essentially it's fiber, fiber, fiber. Fiber is a wonderful prebiotic. Resistant starches are wonderful prebiotics. Things that are fermented, right? So with fiber, we go back to our basics of fruits and vegetables, right? And also some starchy carbohydrates, right? And then foods that are fermented, like fermented sauerkraut, fermented kimchi, all very good in enriching the gut microbiome. Jicama, things like those foods are really great prebiotic rich foods. Yogurt, kefir, right? Or kefir. Some people say kefir. Yeah, fermented foods.
All right. Awesome. Awesome. You heard her. Yay. Now, are there any risks, side effects, or cautions when we come to probiotic? And I've had this asked before where, well, if I'm not, if someone's not feeling well and they give them viruses and, yeast, can it overtake growth and cause more damage? Like, are there certain risks, side effects, or cautions when it comes to probiotic use?
I think that if your diet is normally okay and you are not immunocompromised, and when we say immunocompromised, we mean that there's something off with your immune system. And this may happen if you are maybe on chemotherapy or you're on certain medications where they are intentionally trying to reduce your immune response.
Mm,
You may actually be more prone to getting some kind of infection from a high dose probiotic. This happens rarely. We've heard of some cases in people in the ICU who are on, pressors and, kind of fighting for their lives. Their immune system is very much off, and we give them a probiotic. And sometimes, in few cases, we will find that they develop a blood infection with
mm,
the bacteria that was in the probiotic. So this is rare. It is not common, but there are situations, right? There are some probiotics that will also increase lactic acid and cause a D-lactic acidosis in some people. Again, rare, not common, and I think your physician may be able to diagnose this. But generally, we do know that some people just don't tolerate probiotics. They start
mm,
them, they feel bloated, they're uncomfortable, they have diarrhea, or they're constipated. And when that happens, it could be two things. There's something else going on,
mm.
the microbiome that we need to deal with, or there are ingredients in the probiotic in the supplement itself that that person is reacting to, you know?
So
Yeah.
certain select patients with HIV, like
Yeah.
immune system being attacked. It's not a discouragement for those who are watching. It's just taking this into consideration, and that's why these are medical suggestions. It's important to make an appointment. You reach out to Dr. Asamoah and have that conversation. All right, my last question before we wrap up. Someone may be wondering, how do you take probiotics with other medications? Are there interactions? Should we be worried? Is that generally speaking, Doc, what would you say to that?
Yeah, yeah. So we don't see a lot of interactions with other medications, but in order to improve the efficacy of the probiotic, so that the probiotic and the bacteria in there actually engrafts in your gut, you want to take it 2 hours away from eating, right? You want to take it when the gut is not working with other foods and digestive juices are there, which may even digest or break down some of those. So 2 hours away from food is the way we generally want to recommend probiotic use to improve efficacy.
Awesome, awesome. This has been rich, Doc.
I'm glad.
I learned a lot too, and I'm sure those who are watching have picked more than one or two things and can also share this with their loved ones. And so, people are wondering, Doc, how can people connect with you? Either have you come speak on their platforms, or work with you as a GI doc. I know you're in the Texas area, but Doc, where can people find you?
So I'm in Texas. Y'all are welcome to visit. Y'all in Katy, Texas. West Houston, Texas. We are here. I have a private practice here in Texas. We've been in private practice for about almost a decade, 8 years now. But I'm also following the steps of Dr. Tolu. I'm on social media too. And you can find me at Dr. Vivian Asamoah on Instagram, on Facebook, on LinkedIn. But I think most of your patients, and I'm going to invite all your patients from Living Spring Family Medical Center to join our private Facebook group called the Natural Gut Relief. And the
Mm,
Natural Gut Relief is a wonderful space where our community shares everything about how to relieve gut issues naturally, holistically, using food first as medicine, natural grandma remedies, right? And everyone is kind of sharing the latest discoveries of what works. And so you're welcome to join us this week. For example, we're talking about hemp seed and the benefit of hemp in terms of the omega richness of hemp. And we do that kind of every week. We have wonderful guests, and hopefully, Dr. Tulu will grace us with her presence soon to talk about family medicine stuff. But that's a wonderful place to find educational, reliable resources by an integrative gastroenterologist.
Oh, awesome. And I'll be honored to come on. And I want to put it here so everyone has it. I've put the links and in the comment section is also showing on the screen as well. So people can reach out. I love your emphasis on using food as medicine. Is very, very important and to know the tools we have at our disposal. Of course, see your doctor is needed, but hey, food is supposed to be used as medicine. It's one of the gifts God has given us for our sustenance. So there you have it, Natural Gut Relief on Facebook. We've also put your address. She's Houston Gastro Institute. Okay,
Yeah.
girl, we should hang out.
Yeah.
Yeah, I think about it.
You coming to Houston? When are you coming?
We can work it out. We can, that's a good one.
We
We
can
can
work
work
it
it
out. You
out.
gotta come. You gotta come. You
Oh,
gotta come.
oh my gosh, we should work that out. We should work that out. But this has
Absolutely.
been so good. I really appreciate you for taking
I'm
the
glad.
time, and you took the full 30 minutes too. So thank you, guys, girls. Those of you watching, show us some love in the comments. This is a big deal, and she's a busy doc. So I appreciate you for coming. Okay.
Thank you so much for having me on. An absolute pleasure.
All right, awesome. Thank you all for watching. Those of you who watch live, those of you who watch on replay. I see Joselle joined us, Bernadette. Thank you for joining. Ifeoluwa, thank you for joining. Obusola, I appreciate you, Jimmy and Adebinte. I appreciate you for stopping by. As always, caring and sharing. Please forward this video, share this, or comment or tag people in the comment section. Those who you know will benefit from this. And as always, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will have conversations like this to help you live long and well. As always, I am she. Have a good one, everyone. Thank you so much.